everyone, my name is Psek. Thanks so much for having me today. Today we'll be talking about learning healthcare systems. First, a little bit about me. I am an assistant professor at the George Washington University at the Milken Institute School of Public Health in Washington, D.C. And I've been there faculty for about 3 years. Prior, and this will come through, prior to going there, I was working at a healthcare system called Geisinger as a delivery system scientist. And that's really where I began thinking about and working with my colleagues around the learning healthcare system. So when we think about a learning healthcare system, one of the first things to think about is even what is a system? What does that even mean? And so I thought I'd start with a real short primer on what a system is. So Meadows describes it as a system of interconnected elements, really, and that can be anything that's coherently organized in a way that achieves something. So a very broad kind of definition, but it really gets you thinking about there's pieces that are interacting. Clearly there's going to be a goal that the system is trying to improve. And so Churchman, who was really one of the founders around thinking of systems and systems thinking, describes that all systems have these 6 elements. So the first one, when we think about the environment, so what is the boundary of our system? It sits in something, and so that's the environment that the system is sitting in. Next is the resources that we need around the system that we're developing, and so that could be anything. That could be people and talent, it could be finances, it could be physical resources and those types of things. Next is components, and the way Churchman thinks about components is how do we organize these resources? So for example, in a hospital, that may be the units that we do it, or a ward, or an operating theater. Those are the types of things in terms of components. And this is not only for healthcare systems, but any organization is typically divided or designed within units or departments, for example. Next are the interconnections. So what are the connections between these components, between the components and their resources? And those interconnections typically involve things that flow. And that can be a number of things. That could be people that flow through. So what is the relationship between people, between maybe the finances or income, those types of things. What are the interconnections? Data. How does data flow? We have goals. So all systems have a goal. Sometimes it's very clear and sometimes it's not. And sometimes it's designed with a particular goal in mind, but there's other consequences or other things that arise that we didn't plan for. And we see that a lot if you think about just the world we live in, where we plan for one thing, but something else happens. And these are typically complex systems where things arise that we didn't quite predict. So there's the goals, and then finally there's the management of the system. If we think about it, how do we organize so that all of these things are done in the right way to achieve our goal? And this is typically where our management structures and leadership come in. So this is just thinking about what is a system. The other thing to think about when we do systems thinking, what's our level of analysis? What's the level of the system? Because if you think about it, we have in healthcare, we have a family care practice. That could be as part of a hospital, and that hospital could be part of a system with multiple hospitals, which could be part of a bigger organization. And so we have these levels, and at those levels, when we think about systems, we want to know where are we, so that we can begin to understand what are the components at that level, and also how do the levels interact with each other. So for example, this is based off of a model by Shortell and Furley, and the idea is that you have your patients, which are sitting in an embedded, one level. They're embedded with the providers, which are part of the unit, which are part of the organization, which are then part of the health system, which sits in the environment. And you can imagine that there's different things within each one that can be influencing the patient. So for example, in the environment, we might be thinking about policy. How does the policies, different policies in terms of reimbursement, for example, or legal structures impact the patient, the provider, and the unit? So for example, if we think about a question which would be, why do some patients do better than others? Well, the answer typically is, well, that depends. And it depends. Why? Because when we're thinking about a systems context, it could be because of the patient. The patients might be different, and so we would need to adjust for that and think about those differences. The provider team, they may be different. The unit, there may be differences about the types of people working in those units, where they're located geographically, access to those units, and so forth. So at each level, we need to then start thinking about what's the impact of the context that will impact the question or the types of things we're thinking about for a system. And when we think about the learning healthcare system, what we're going to talk about today is very much focused in at these levels, right? The delivery side of the learning healthcare system, including from the health system down to the patient. And we'll talk more about what a learning healthcare system is and those definitions so that you'll see where this one's fitting in. So W. Edward Deming, he sort of comes up with this really great quality guru, came up with this really nice quote, because when you look at it, it's pretty general, right? A system is really everything, but really for you as participants of a system, it's important to understand what is the system I'm in, and it's not just one system. Typically, we're all engaged or involved in multiple systems when we're thinking about systems. So the learning healthcare system, essentially what is it? So when we think about the history, where did learning healthcare system models, where does it come from? So around 2007, the Institute of Medicine brought together a roundtable for value and science-driven healthcare. And really it was start thinking about how can we improve the quality of care delivery, but also enhance the use of evidence and have greater involvement around discovery and research to support clinical care. And so they focused on these three areas around value, so certainly about quality and improving, making continuous improvement. They looked at science, so how do we generate evidence as a health system? How do we use that data and that evidence? And then also looking at culture. So, you know, they say culture is everywhere within an organization. How do we create a culture so that our staff and employees, our providers, can do what they need to do, have what they need to have for continuous improvement, as well as engage our patients and have our patients involved in care delivery, so we have this continuous cycle of learning. The rationale behind the learning healthcare system, well, was sort of, and it remains today, these same kinds of things. We have really high costs within healthcare, a lot, high spending, highest in the world, variable quality. We've been thinking about quality. We've had, Crossing the Quality Chasm report, to err is human. We've known about and we've been focusing on quality for a long time, and yet it's still variable in different places. We still haven't achieved the real goals that we've been driving towards. Shifting to value. So moving towards, well, first we need to really clearly begin to define what is value and to who, to the patient, to the provider, to the health system, to our staff. But then moving into that space, and also in terms of a policy perspective with value, having risk-based payments, and moving from fee for service to this quality-based reimbursement. We're seeing an expansion in IT clearly, and so an explosion of data. The question is, are we organized to actually use that, and in what way? And we've still got, so they recognize this is from years ago. Finally, well, I guess the two things, patient-centeredness. So the movement towards having patients be engaged around their care and all that means, having them as a central focus in terms of their care, and organizing around that is really growing and is now part of most care delivery systems, but is it being done well? And then finally, evaluation. How do we capture, how do we know what we're doing is being done well? How are we measuring processes? How are we measuring outcomes? How are we measuring the things we're doing, and then being able to take those learnings, scale them, generalize them, so that we can continually learn. Within the series, the Roundtable, they came out with a number of different reports, and I'd encourage you to read around these different reports, and each one has a different view around the learning health system. So we have sort of the originals, but then things looking at the evidence generation, looking at methodologies to capture learning in different organizations, to structure IT. And so there were about 13 different reports that came out, and then the latest one, Best Care at Lower Cost, with a lot of views from different people looking at the learning health system within their own organizations, but thinking about a way that we can bridge all of this continuous learning. So the underlying principle around the learning health system was, and that this roundtable was charged with when we think about the clinical care, the science, and the culture, was we constantly generating ideas, capturing data, trying to do studies. But then what happens is, or even if we think about our patient, just a regular patient visit, we're generating ideas, there's learnings that are happening, but what happens is we capture it, but then we begin to lose the evidence, gaps open up, we don't follow up on certain things, we don't capture the learnings, and so the evidence that is generated is slowly lost. And this is from that report, the Best Care at Lower Cost, from the IOM, such that by the time we get out to the patient experience and how the patient is experiencing care, we aren't really capturing all the learnings that could really support that care. And so in the learning healthcare system model that the IOM developed, they really created it as more of a cycle where we have our science generation, and that can be from bench, but typically within healthcare systems, it's capturing our outcomes, figuring out the processes, generating evidence. So how do we make that? What does that look like when I talk to a patient? What does that look like in terms of building evidence? How can that experience that I'm having help me when I treat my next patient, or help me thinking about my population of a certain kind, or help me think about the health of our community? That evidence, and then bringing it back into care. And so you have this continuous cycle, but really the focus is around patients, clinicians, and communities. So communities have been baked into this model, as have the patients and clinicians. And the idea is that we're continuously learning. They're very aware that you need structure around this, that you need to have resources. And so some of that is in terms of think about leadership, thinking about culture. How do we design an organization so that everybody gets that we should be learning and what that means? How do we then also incentivize both all of these activities? And that means incentivizing patients, incentivizing our staff to want to learn. And there's various different mechanisms that different systems are utilizing for this. This is a quote from the report and sums up what they were thinking around learning health systems. So it's a system in which knowledge generation is so embedded into the core of practice that it's a natural outgrowth and the product of the healthcare delivery process leads to continual improvement in care. So it should be this idea that we're constantly learning, and we never stop. All organizations learn. The question is, how do we capture that? The Roundtable and the Institute of Medicine, they really had a very clear vision for their learning health system. The first is really around the patient delivering safe, effective care, right? So a real strong underlying core on quality. The second is that it should be focused on all patients, right? It should be equitable, that all patients are engaged in the learning. And that's still something that we're trying to catch up on in a lot of areas. Next is that it should be point of care. So every touch point within a health system could be an opportunity for learning. And so the question really is, are we organized for that kind of learning? When we think about the underlying functions that organizations do healthcare delivery, with especially academic medical centers where we have these core of sort of education, research, and clinical care, those need to be aligned. One of the big issues that we see around learning healthcare systems is management have their strategic objectives, research have their objectives, clinical care have their objectives, and there's this misalignment across those groups. And that's really what they were trying to achieve with this model. And then finally, thinking about how, just as we talk about when we think about quality, how quality is really everybody's job in a healthcare system. Well, we also have this idea that that's part of learning. Everybody should be engaged in learning. How we structure that is different in different settings, but everybody should be a part of that. And that's all participants in the system, including patients, their family and their caregivers, including physicians and providers, including managers, including researchers, and then other stakeholders within the community and beyond. Really thinking about how do we get everybody in so that we're all learning so that we can improve constantly. Their goal, drive high value care, right? What I'm going to talk about now is a way to think about how can we organize healthcare such that within the delivery sides, such that we can begin to do this continuous learning. And this is a model that I developed with my colleagues when I was out at Geisinger Health System. And really it was designed to fit with any organization. It has these 9 domains. And as you'll see, none of them are really challenging or different. All organizations have these 9 domains. They just have them potentially in different structures or in different resources around them. So the first is data and analytics. When the Institute of Medicine came out with their model, they had a very strong focus on having data and analytics support the system, the clinical, the patient, and the research integration be supported by data. The data and analytics, and so this is something I want to stress for you guys being in different organizations, is thinking about, you don't have to be a high-end, high-tech organization to be a learning healthcare system. The question is, how do you capture, because all organizations create some form of data, right? And that could be an interaction with the patient, it could be labs type of stuff. There's a lot of, think about what data you have and how you capture that. Some of the examples that we see around data and data analytics is thinking, data warehouses, but also just, are you capturing a patient's information on paper before they come in the waiting room? Is it digitized? Thinking through how do we get that data, and then how can we use it, especially to close care gaps and automate things so that we're not adding a burden of work to our providers and our staff. The next one is thinking about people and partnerships within and outside of your organization. So who's driving the learning process inside? What does that team look like? How do we structure our learning team so that people feel included and aren't isolated? How do we think about inviting patients on and having them advise and think about learning? Same thing, and who's at the table? And the same thing with partnerships. Do we bring people from outside to help us with our learning to structure that? Or can we do it inside? What is our understanding of knowledge? Patient and family engagement, this is a core part of the model and always has been. And so the idea is, how do we organize so that patients, families, caregivers are engaged in the process? And there's various different ways. Hospitals and health systems are trying different things, but really it's about understanding who they are, how they can contribute, being able to communicate that with them and make them an integral part of the learning. And that can be both at the bedside on a one-to-one with a clinician, as well as sort of within research studies, out in the community, and thinking more broadly about your population, it's really important to think about how are we engaging them within the model. Ethics and oversight. So what's really interesting, a core component of our learning health system is around research and discovery, right? Because as we're learning new things, we want to take that, generating evidence, and then reuse it and keep building. So what kind of governance, what kind of structure do we have in place within our organization that will make sure that we're doing this, we're protecting our patients, and that it's done in an ethical way? And so what we're seeing is different organizations are restructuring around their IRB. They're re-looking and rethinking about what is this continuum of delivering care. You know, we're moving away from that, well, not moving away, but the learning health system pulls us in a different direction from pure research and pure quality improvement with innovation sort of in the middle of that. The learning health system starts to blend all of those because it's a robust learning. We don't have, you can do your traditional learning, but if we want to learn at the bedside and act very quickly and make a change, we need governance in place, and we need our IRB in place to be able to understand that. And so ethically, there's a movement around learning health systems to try and change that, and there's a framework. Think about evaluation and methodology. Again, a core component where we've always been siloed around research typically, and clinicians and clinical care with operations. The idea here is to begin to blend that, and to do that we need tools and approaches and evaluations that are much more robust to allow our clinicians and our managers to be able to do what they need to do in terms of delivering care, but at the same time learn. And part of that also means things like changing our, aligning our incentives. So for example, where researchers typically their incentives are bringing grant money in or doing publications, whereas our clinicians and our management folks, their incentives are arranged differently. So it's starting to think about how do we align those. And I would say, just in from methodology, there are a number of new interesting methodologies that we can use within the space besides the typical approaches we used to use. Thinking through funding, this is a really important area, and somewhere probably the one that's lagging the most. There are some healthcare systems out there where they are promoting, where the clinical operations are providing financial support to researchers, around the management to try and change this. But this is an area where we're still gaining sort of experience. But the idea is to think about funding both internally and externally. How do we fund this change? Again, it's not about an activity that we're doing. This is a fundamental change that we want to do for our organization. And so the areas where funding and support comes from should be both internal and external. These prioritization, when you're thinking about putting in a learning healthcare system, how do we prioritize? What are the key things that we need to do now? Right? If you're doing it on a grand scale across a health system, that's a large undertaking, very different to if you're just changing your practice to become a learning organization. So start thinking about, what do I prioritize first? What's most important? Clearly defining the deliverables as you go forward to implementing and operationalizing this learning health system. It's key. It's quite easy for people then to either get lost or to pull back and start looking at their own silos and their own deliverables and their own things that they think are important. Clearly define deliverables. This one, in terms of organizing, this is probably my personal favorite, is really thinking about how does this look in practice? What does that mean? What is that? Who's doing what, where, what are the resources we need? How do we tie it all together? It also means things like culture. How do we start to change the culture, or maybe enhance our focus on learning as an organization so that people feel that it's an important area to focus on, they feel inclusive, and they want to learn, they want to be a part of this. So there's a number of things. How do we structure for management, right? What's leadership's role in this, in changing? And that's also understanding what is learning and socializing this within your organization. So some of the just sort of overview things to think about when we're thinking about how do we create a learning healthcare system, really understanding what do we have, what don't we have, what's our capacity, what are our capabilities, what can we do, and then adjusting your learning healthcare model to that. So if you aren't a high-tech beta site for technology, that's fine. You can be a learning health system. The question is, understand, first recognizing what you have and then how you can use it. Next, thinking about setting expectations and narratives, thinking about those small wins, thinking about the time it will take, thinking about the resources we need, and very much in terms of the narrative, getting people to understand what we mean by a learning healthcare system. Everybody has a different take on what they think is learning, and so if you want to have a learning healthcare system, you need people to be on board and understand what you mean and what we mean by that integrating patients, clinicians, researchers, utilizing evidence on a continuous quality and value improvement basis. Alignment, we're still siloed as most things are, so same thing for your learning healthcare system. We need to get through those silos. Engaging patients. Patients should always be the center of it, and so there's a number of different strategies that you need to use, and again at different levels, right? The patient at the bedside, the patient in the department, the patient in the community, really thinking it through in a detailed way. And then finally, as we started, when we thought about those different levels, what's the context? Because it's going to be different for every organization, and so you need to address it as your own and really understand your organization and what you can and can't achieve. And this was based on our work with my colleagues and at Geisinger. It's available if you need. So in summary, when we think about a learning healthcare system, it's really you need to understand the fundamentals and what you're trying to achieve and what that looks like. Understanding the context, right? Who are we as an organization, as a community, and what do we want our learning health system to look like? Who's involved? What are our boundaries? How do we define our system? Looking at, from an organizational point of view, are we going to use this learning health care system purely as a tool within our organization, or do we want to elevate it to the level of a strategy? And those are some things for leaders to think about. How do we use the learning healthcare system model in our own organization? Really understanding what are our capabilities, what can we do, what can't we do? And that will allow you then to begin to think small wins to be able to build on the learning. Socializing concepts really important. Healthcare systems are complex organizations, lots of different people with different views, different professions in there. So to socialize that idea within your organization, get them to think about what it means to them and why it's important to your organization. Leadership need to buy in, but also thinking about it in terms of the silos and siloing, you want all leadership to buy in, right? It can't be just one person from one area, from operations or from research, really pushing for it. It needs to be everybody. And then looking at what are our learning activities? What can we do initially to get it going before we can build it on a grand scale and develop this out? Because culture takes a long time to develop within organizations. So I'd like to acknowledge those my colleagues out at Geisinger that helped me develop this framework, and as well as Academy Health for their Delivery System Science Fellowship that got me to Geisinger in the first place. So thanks so much for listening to me today. Feel free to contact me if you have any questions, and I look forward to hearing from you.